The following edition of Connecticut Valley Views is made possible by Windsor Federal Savings, with offices in Windsor, Bloomfield, Granby, and East Windsor. Neighbors helping neighbors since 1936. Join me, Susan Regan, host of Connecticut Valley Views, the most widely watched interview program on Connecticut Public Access TV. Proof to the people is the byline, insight without bias, generating a 360 perspective. Our mission is to focus on topical subjects with thought-provoking interviews regarding municipal leadership, current affairs, educational and political topics, as well as key destination points in New England.
And here is your host, Susan Regan.
Hello, and thank you for joining me today. We are here at Mount Sinai Hospital in Hartford, and I have two guests who I will be speaking to. The first is Maura Murray. She is the CRRN MSN Executive Director of Physical Medicine and Rehabilitation Service Line for St. Francis Care. Thank you for joining us. Appreciate it.
Thank you.
And Dr. Robert Krug. He is Doctor, Medical Director for the Physical Medicine, St. Francis Care. I do appreciate you joining us as well.
Thanks
Give
for
us an
having us.
overview of Mount Sinai. Let me open by asking you, Maura, what is your background? What are your responsibilities here on a day-to-day basis?
Sure. I come from, I have about 30 years experience in healthcare. My background is predominantly in nursing. I did move into healthcare administration approximately 15 years ago. That was in Massachusetts through the Spalding Rehabilitation Hospital, and found that there was an opportunity here in Hartford at Mount Sinai Rehabilitation Hospital, and pursued that just over 8 years ago, and was introduced to the work that they do here at Mount Sinai. Met with Dr. Krug and the entire team, and certainly was very impressed with what I saw. So much so that I decided to relocate to Connecticut. And that was, like I said, 8 years ago, so it's gone very well. My role has evolved. I started as Director of Nursing for Mount Sinai Rehab Hospital, and as population management and accountable care has evolved, the role and expectations have evolved, and moved toward first Administrative Director of Mount Sinai Rehab Hospital, and then on to Executive Director for a service line. And really what that requires me to do in partnership with Dr. Krug is oversee rehab services across a continuum of care. So we oversee rehab medicine at St. Francis Hospital and Medical Center, where we provide comprehensive services in the acute care setting. We oversee services in the inpatient rehabilitation hospital, as well as the outpatient area. And we have multiple sites that provide outpatient services, the North Campus being the hub. We've added more recently, about 5 years ago, the Comprehensive Mandel MS Center, which has just grown tremendously, and it's really shown us what the community and people are really looking for, and really providing more comprehensive care. And
let me just ask you, when you say comprehensive care, are you talking about being able to go to one place to get everything that you need?
Absolutely.
Would that be the correct description?
The vision really came from Andy Mandel and his wife Joyce, and they had a vision. They had dealt with trying to seek care for MS, having to go to multiple places, not being able to get their needs met in any one place. So this vision came to fruition with partnership with the MS Society, Mount Sinai Rehab Hospital, and the Mandels, and certainly Dr. Krug was intimately involved in that, as well as Chris Stadlis in administration from St. Francis, and they made it happen. And what I see is patients coming here is they come to one place.
There's less stress.
They see their neurologist,
yes.
They see their therapist, they get their treatments.
One-stop shop.
And certainly, anything we can do to make their care more seamless is
That's a good word for it, seamless, yes.
Yeah.
And that's all part of the rehabilitation process.
Absolutely.
Is not to disturb them or their family, to at least to cut down and streamline that whole process.
Honestly, it's about heightening their quality of life, and if we can make their care and treatment less burdensome and easier for them to access, that's going to add to their quality of life.
Very good. Dr. Crook, your side of the responsibilities. You're the medical side, right?
That's correct, but we work hand in hand, day in and day out. I think rehabilitation medicine in general, or historically, has always been a more collaborative, interdisciplinary team approach, and it's sort of something that's now taken hold throughout medical care, no matter what the specialty is. Our specialty is known as physiatry, so I'm a physiatrist. It's something that a lot of people are not familiar with. So I'm an MD, but my specialty is, if you're on the East Coast, it's pronounced physiatry. On the West Coast, they say physiatry.
Okay.
And it's a specialty that's been around at this time about 80 years. And it really, its focus, where grassroots, was to deal with folks with disabilities and physical and cognitive challenges, because we really didn't have a specialty in medicine to deal with that. And really, as technology improved and techniques improved, right around the time of World War I, we saw people that were being saved, but basically they would hand them a wooden wheelchair and say good luck.
Yes,
They didn't have legs, they had
Yes.
spinal cord injuries, head injuries. And so the specialty took it hold then, and it's really evolved and taken off over the last 80 years. And it's expanded into musculoskeletal medicine, pain management, interventional pain procedures, bracing, wheelchair management. And so we work very collaboratively as leaders with physical, occupational, and speech therapists, audiologists, neuropsychologists, and then our other colleagues, whether they be neurosurgeons, neurologists, orthopedists, really as a team approach in dealing with these complex patient issues.
Well, I really believe it goes hand in hand, because there's that old song, the whatever bone is connected to whatever bone, mind over matter, mind over the body, because the body, when it's not well, the mind doesn't work well or gets depressed.
Absolutely.
When the mind is in bad shape, it causes problems and stress to the body. So what you're really doing is taking a group of specialists and putting them together to address all of the issues in the best way that you can to make the person whole again.
And that's absolutely what our approach has always been. And I think accountable care now and Obamacare really speaks to that. And as Maura was alluding to, we for too often have been dealing in silos in healthcare, and it's very
It's the CIA is
yeah, it's very
not the same
fragmented.
thing.
Nobody knows. People
Right.
are getting multiple recurrent studies done because people don't have access to it. And so really,
It cuts down redundancy, doesn't it?
absolutely,
X-rays and
Right.
the tests and
and
things.
cost and efficiencies. And so, the Mandel Center for Multiple Sclerosis is a shining example of that. But really, we have other programs that are examples of that as well, whether it be the stroke program. We have a traumatic brain injury or acquired brain injury program that has a day treatment component that hopefully we'll get a chance to talk about in a little bit. But it's a model of care that really is what people are demanding, and with the
need.
and with the aging of America and the finite fiscal resources available to us, it's imperative that we try to do more with less, and that's what we're
Consolidate.
trying to do.
And
Yeah.
consolidate. Well, there is a historical significance of the relationship between Mount Sinai and St. Francis. And as I understand it, this affiliation has been going on for 25 years, and we will talk about miracles and the fundraising that will be done for that. That's an event that happens on an annual basis, and you will be the recipients of the money from that fundraiser. How did they actually come together? How did they determine that this was going to be a significant correlation between the two?
Between Mount Sinai and St. Francis.
Yes.
Both were well-respected models of care organizations in the Hartford region. And, like anything else, times change, populations and demographics change, people move to different areas, and, people left the city and went out into the suburbs and so forth. And so the need for having 3 inner-city hospitals, I think the financial equation wasn't working. Now, I have been in Hartford for 18 years, so my time here sort of came just after this went down. But I've been here long enough to understand the history behind it, and so I think that the leadership of Mount Sinai Hospital and the leadership of St. Francis recognized that to maintain one strong entity, they needed to join forces. And that's what happened. And it started as an affiliation, and it progressed to a merger. And many of the physicians who were walking the halls and treating patients in the old Mount Sinai Hospital are still active as clinicians at St. Francis. And now many have leadership positions or on boards and so forth. So the spirit of Mount Sinai, the culture of it, the mission of it, lives on both in Mount Sinai Hospital, but also through the walls of St. Francis.
Well, it's a good marriage, obviously, because you
Absolutely.
complement each other.
Absolutely.
And I think that you're striving towards the same objective, which is the best quality care you can provide towards the patient without the competitiveness between two medical facilities. And I think that's the best of both worlds. And if you both have that you're on the same page and the same objective, then you're going to work towards that end. Which is very clear. Now, you have a unique level of care and services that cover. What could you, if you could identify more of, what would you say might be the key things that Mount Sinai brings? We've talked a little about the fact you have everything here. How would you differentiate yourself, say, from another hospital in the United States? Because this is a destination point, is it not, for some people who may live in other states?
Absolutely. As far as, certainly our relationship with St. Francis Care, an acute care medical hospital, gives us access to, ancillary services and expertise that, certainly is a tremendous value. Specifically on the North Campus, we've been able to really look at the evolution of post-acute care. And not just post-acute care, but that is a huge component of the rehab hospital and some of the work we do in the outpatient services area, as well as day treatment. And it's really, our goal is really to get patients to their optimum level of functioning, to return to a life that's meaningful. That's really what
That's a
drives
quality
us.
of life, sure.
Absolutely.
Quality of life.
But we also see an opportunity in our setting. There's a lot of health promotion and prevention and wellness. So even as patients come through the continuum of care, we're not finished. Our goal is to continue to help that patient stay well. So if they had a traumatic event, they've come through the system, we have helped them heal and recover. It's about, keeping them on that road to recovery and participating in their life in the most meaningful way. So we have the ability to do that. We have such comprehensive services on this campus, from what we're able to provide we're the only freestanding rehab hospital in the state of Connecticut.
Well, there you go.
So that certainly sets us apart from others. We're able to provide certainly a higher level of care and expertise to patients that certainly need and benefit from our services, all the way through to our outpatient areas. We have expertise here and access to technology, as well as therapists who have specialized in approaches to care and treatment of patients who have had a stroke or a traumatic event. They have that expertise and technology to treat those patients.
Yeah, it would seem to me that you have the medical expertise, you have the ability to give people optimum care, but there's something else, there's another element here that I sense, that I've always sensed with St. Francis, and I feel there's a carryover to Mount Sinai, that your bedside manner is there, because there has to be a relationship. For people to get well, they have to have confidence in the people who are treating them. They can't be treated as a number. They can't be treated as another person to get in and out of a bed. And by taking that extensive care beyond after they leave here, that you're still interested in knowing how they're doing and how is it going and is there anything else we can do. That changes the whole picture for people, because people want to be treated as individuals.
I would say that certainly the patient is at the center of everything we do, and included in that, because it's so important to support the family and those supporting the patient. That's what we're all about, and we certainly, throughout the care and treatment of the patient, that's always at the forefront, and making sure that we're meeting their needs and achieving their goals. And
they become part of their own care.
Absolutely. They're the most important member of the healthcare team.
Yeah,
Absolutely.
that's true. All right.
Could I just
Yes, certainly, of
I
course,
think there's
go
an
ahead.
important point to be made here. you mentioned this is a unique level of care, and a lot of the other facilities at the level below us, which would be a skilled nursing care, they do a lot of great marketing and promotion of their rehab units, and I think it's an important message for your audience to understand that there are really not a lot of regs at all as to what that means or what constitutes that, whereas our facility is under tremendous regulation and requirements from Medicare and the government as to what we must provide. We want to provide it, but we don't have a choice.
Yes.
We must provide
Yes.
it. And there's a world of difference to that, and it's not always clear. In fact, it's usually not clear from the brochures and the marketing that you see. And I think it's really critical that people understand that they're going to get a lot more when they come to a facility like this. And if you're able to handle this kind of facility and get 3+ hours a day of therapy, and that's physical, occupational, and speech therapy, be seen by a physician on a daily basis, know that there's an in-house physician 24/7 to meet your needs, know that you have neuropsychologists and other specialists here, and that we have technology and equipment that really doesn't exist anywhere else in the state.
Well, that's key to note, and I want to also point out, and correct me if I'm wrong, people keep their primary care physician in the loop. Is that correct?
Absolutely.
Okay, because I think that's very important to people to know that that home-based person is in the loop and that they haven't been sort of shipped out. That's part of it. Again, there's that trust thing, and that's all part of the care thing, to know that they feel they're with someone and that their primary care physician that they've been with for however many years is going to still be advised as to what's going on.
I mean, certainly transitions in care is so critically important. So as a patient is going through the continuum of care, making sure that, all the information that is needed to get the patient to the next level or continue to support them on their recovery goes from one level of care to the other. And I think accountable care really is reinforcing, like, that's not an option anymore. It's a given, it's a requirement. And certainly we've always had the practice of making sure that we're communicating with the PCP or the patient's primary. When they're being discharged, they know exactly where the patient is at, what they've gone through.
Because they know that person through personal things, family issues and things. So they've got a lot of other ancillary information that may play
very
in on
valuable
something.
for the primary care to be involved in, and certainly aware as to where the patient is and how they progressed after whatever event they've gone through.
Right. Well, certainly the baby boomers are going to be impacting and are impacting what happens in the level that you have to deliver on and the number of people. So let's talk a little bit about that, but also I'd like to ask you, the fact we have this changing of demographic profile, which is now going to involve possibly VA people, if they are going to offer that expansion, if they go beyond the VA hospitals, that's going to put another bit of pressure on you, is it not, Doctor?
Sure, it's something that we've certainly offered that to the VA, both this hospital, but I think industry-wide. I mean, I think that it's well accepted that the VA system, which has a lot of excellent, good points, and I think you only hear about the negatives, quite frankly, but they have a lot of good care that they provide there, but they're overwhelmed. I mean, this country's been at war for 20 years.
Sure.
And they're overwhelmed, and we in the rehab industry can really help deal with some of the complex issues and problems that a lot of our veterans are dealing with.
And you're going to have a lot of people that, I mean, let's face it, there are issues, emergency service that is provided to people in the community. Let's just be honest, there are people out there who get shot. There are criminals who get themselves involved in things. They are not covered by any insurance. There probably would never be any intention to get. And you people have to absorb the people who come off the street. Absolutely. And you, by rights, have to take care of them whether there's money to cover them or not. So you're really absorbing not only the effort and the services, but also economically. This is impacting you. Now, so you wanted to speak to some specifics here about patient populations and innovative programs, and we're talking about the Mandel MS Center treatment programs and lymphedema. Am I saying that correct?
Yes, you are.
All right.
Yes, you are.
And what is SCI? What is SCI?
Oh, SCI is spinal cord injury.
Okay, spinal cord injury, movement disorders, Parkinson's, spine care. So you offer all of this. All of this.
These
is
are all
involved.
different programs that fall under our service line, correct?
If you were to choose, doctor, one of the most impactful areas, or let's say one of the biggest issues for our population right now, what might it be?
Well, I think the biggest is, again, the aging of the population.
Okay.
And, you know, if we're talking about Connecticut, right, Connecticut
Yes,
is,
let's talk Connecticut.
Connecticut's not a high growth, you know, state. It's not like we have a lot of people moving into Connecticut.
Right.
However, we are an older state, and so what we're going to see over the next decade to 2 decades is really an aging of the state. And that's going to put a lot of pressure on our healthcare system and on our, you know, fiscal responsibilities as a community. And I think that, you know, it's imperative that the hospitals, and particularly our hospital, are ready to meet that challenge. And so we at St. Francis Care and at Mount Sinai have taken a very proactive approach to that.
And not only because the population is growing, but because people are living longer
Yeah, absolutely.
and hoping to live better.
And they want to live at home.
And they want to live at home, and so
Right.
they have the long-term care, or they want to have the option of being able to stay at home
Sure.
and having caregivers. So the aging population and all of those things that are involved in it, whether it be Alzheimer's or of those, so we're talking baby boom would be the largest part.
Right,
of
so
what
we
you're
have
addressing.
programs to work on people's balance and fall prevention. We can send teams into the house and look at, you know, risks and remove them, whether they're throw rugs or not well lit
Right.
areas, or, you know, maybe you shouldn't be
Up and down stairs.
up and down stairs, or getting, you know, trying to climb over into a tub shower.
Yes.
Recommending putting in bars and so forth, and other recommendations, and then making a real determination as to what level of care you really need to help support you in the home. Are you able to take your medications on your own? Do you need a pill box set up? Do you need a VNA to come in and provide additional
Well, this
services?
alleviates also family, the stress that's put on the extended family too, because not only is the patient and the person who's going to be addressed and all of those issues that you help with, but that takes some of the stress off the immediate family, the daughters, the sons, the daughters-in-law, their responsibilities because they have children and other things to take care of too. So if you can sort of do preventative medicine with
I
regard.
think prevention and wellness is certainly, I think, not just Connecticut, but, you know, the entire country really needs to invest a lot of time, energy, and resource in prevention and wellness. And just because we're aging doesn't mean, you know, that equates to illness. People are
Well,
like
there's
you
depression
said,
too. There's just plain depression. People are depressed and then they get innate and they don't leave their house and they don't participate.
you know, part of what we can do, and certainly within our service line, you know, we have a fitness program. A lot of our patients graduate to the fitness program. It's very positive, it's very uplifting. We've also recently, you know, brought onto this campus partnership with integrative medicine, in which, you know, they're providing, you know, acupuncture to patients that are helping mood and how they feel about, you know, approaching their day. We're open, you know, here. We have, as you mentioned, we have a lot of different services on this campus. Behavioral health and psychiatry is on this campus. Such a nice partnership in the work we do, because we're not just looking at their physical well-being and their medical complexities, but we're also looking at the, you know, the mental and emotional components.
Which is where the overflow from VA
so
would come in well.
It's been a unique marriage of services on this campus that have really set the stage for us to provide amazing care in the post-acute care environment, but also in the prevention and wellness end of things. You know, there are things we can do together to prevent somebody from progressing to a fall, to a fracture. You know, so it's been really wonderful for us to have the variety of services on this campus to partner with.
And what I think we're getting to now is the bottom line, because all of this does not only cost money to people, but there are obviously, you're kind of the business end of things, and you need to watch the bottom line. And so, which brings us to Miracles, which will be coming up this fall. It's the annual event raiser that was established by St. Francis Care, and the affiliation between the two hospitals for 25 years, this will be the 25th one, is very, very important. So what we want to talk about is that there are a great population, a greater group of people are aware of it, but I think they might be interested in attending it. So I'm going to give some information with regard to that. But this is a wonderful event. People donate wine for a wine auction. I'm sure you're looking forward to having maybe your own table there and having your own guests. But again, I think the feeling that the dedication of St. Francis Care in this annual event and all of the funds going towards your programs and the programs that you've outlined, I think is very key and important, because they recognize, St. Francis Care recognizes how important their partnership with you is. And I'm sure will mean a great deal to you. So we're hoping that people will participate in that. Now, I am going to be giving a website for Mount Sinai, and it's actually through St. Francis Care. So it would be www.stfranciscare.com. And for people who are interested in tickets to the program or in giving wine donations, you could go to a website that would be www.stfrancisdonor.com and go to special events. And there's also a phone number, 860-714-4900. So I hope that we have covered, I know that we certainly haven't covered everything that you do, but I do want to thank you very much for your time that you gave today. Thank you, Dr. Krug. We appreciate it. And we certainly wish you well in the program going forward. We hope you will raise tons of money at this event.
Thank you very much.
Okay. Now you can see us on Facebook, and you can see all of our programs on www.ctvalleyviews.com. But I want to tell you about something else that we've added. We are going to be starting something called a web-based element publication. It's called the CT Web Element. It's going to make us the only independent producers of both Connecticut Public Access TV and online communication media, bringing you, the public, the optimum grassroots voice. Our objective is to provide public at large specific news, educational and incisive coverage of local and national issues via interviews with Connecticut Valley View guests and an aggregate of published commentary on issues important to our state citizens. What other things will you find on the Connecticut Web Element? Eagle Eye. It is a compendium of coverage on national issues and politics. Neighborhood Watch. It is going to be a registry of sex offenders, scam, consumer fraud, updates. Act 2, it will be news of interest with links for sign up for free stuff, opportunities for optimum life quality for those 50 and plus, education, business, economy, health industry, and on the light side, we will have humor for the day. So look forward to that. That will be up and running in the near future, and we hope you will join us in that medium coverage as well. This is Susan Regan. Thank you for joining me and bringing proof to the people.
Our thanks to Windsor Federal Savings for making this program possible. Neighbors helping neighbors since 1936.